insurance reform? All right, welcome, welcome. Thank you so much for coming out tonight, everyone. What a beautiful and diverse crowd. Give yourselves a hand. And let's thank our wonderful sound guys. All right, great. My name's Brandon Keating. I'm the State Director for Organizing for America in Virginia, and I am really honored to be here with all of you tonight. I'm going to say a quick couple words about how our agenda is going to go, and then we're going to hear from some wonderful folks who have been out on the street working, talking to their friends and their colleagues about the urgent need to get health insurance reform done now. Fantastic. So all summer long, as I mentioned, folks have been out gathering declarations of support for the President's 3 principles for health insurance reform. And those principles are reducing cost, guaranteeing choice, and ensuring quality care for all. So today we're going to hear from some folks who, from different perspectives, understand very deeply the need for health insurance reform. And then we're going to have the opportunity to hand over 40,000 of these declarations to Senator Warner's State Director, who has been so kind as to join us out here tonight. Yeah, absolutely. Let's give her a hand. So without further ado, I'm going to hand the microphone over to Lisa Kelly, who is a person who has been living the struggle for health insurance reform and has a very clear perspective on how and why this is an important issue.
Hi, how are you? As Brandon said, my name is Lisa Kelly, and I'm here to talk to you about a kind of a patient's perspective on the healthcare situation. For the last 20 years, I've been diagnosed with multiple sclerosis, and that marks actually half my life that I've been sick with this illness. For those of you who don't know, MS is a disease that attacks the brain and spinal cord, and it can cause everything from pain and fatigue to paralysis and double vision. And the symptoms vary from patient to patient. It's an unpredictable disease, but the one thing over the last 20 years that's been entirely consistent is constantly having to battle with the health insurance systems to get benefits paid or to get insured to begin with. Simply having a diagnosis of MS makes me ineligible of getting any kind of private health insurance unless I get it through an employer or unless my husband gets it through his employer. And I wanted to share with you just some of the problems that we've had in the past. Shortly after I was diagnosed, my husband worked with a small employer. They had around 30 to 40 employees. It was a small science company, a microbiology company. These were a group of 30 to 40 20-year-olds who were mostly healthy, and I was the one sick person on the health insurance roll. Because of my illness and because of my diagnosis, even though I wasn't in and out of hospitals, the health insurer sought to raise the rates for the entire company, double, triple. It skyrocketed to the point where at one point they actually threatened to drop the entire company from its health insurance because of me, because of my illness. I had no other choices. There was nowhere else for me to go. Because nobody else would insure me on my own. Finally, I became disabled enough to qualify for Medicare, and that was unfortunate for me, but it was actually kind of saved the company and allowed the company to continue providing health insurance for the rest of its employees at a reasonable cost to those employees. Over the last few years, I've been really fortunate that my husband works for a large employer. He works for the state, for the Commonwealth of Virginia. And because of that large risk pool, I don't have to worry about being threatened to be dropped because of my illness. The thing that we have to deal with on a yearly and a daily basis is trying to keep up with the rising health care costs. Every year, our costs, our out-of-pocket costs continue to rise. But as a state employee, we haven't been seeing any pay raises raises to keep up with those health care costs. So we haven't had a raise in the last 2 years. It doesn't look like we're going to have a raise in another year or two, hopefully. And but just over the last year, I'm having to pay another 20% for treatments that I need that actually keep me on my feet, literally keep me standing. And those, because of those costs, my family is having to make some tough choices about where we're going to be able to get that money, how we're going to be able to afford the cost of my medical care. And these aren't choices that are easy to make, but they have to be made because I have children to take care of, and I have a family that needs me walking around and able to participate. These are the things that lots of people, millions of people have to deal with. I'm fortunate in that I have access to health insurance. A lot of people don't have that. But these are the reasons why we need to have lower costs. Average Americans are hurting under the current healthcare system, health insurance system, trying to afford their healthcare costs. We need to have more choices for families. For those who are employed by small employers or who are self-employed, they need to have better choices. It would have helped me all those years ago if I would have had a public option to choose from when my husband was employed by a small employer. We live in a great democracy, and if we truly value human life, we need to make access to quality health insurance a human right. It shouldn't be something that's simply a choice. And we need to do it now. We need to get this done now. And I want to thank you very much.
Thanks are going up for even those who are insured, with the average family of 4 paying upwards of $16,000 per year in health care costs, and how over 50% of our bankruptcies are based on health care costs, and how our health insurance system needs not to be employer-based. Our next speaker is John Bowman, who is going to speak from a little bit different perspective. John runs the Fan-Free Clinic here in Richmond. So he has a perspective of somebody who runs a medical delivery system.
Thanks, Brandon. Thanks, everybody. Boy, it's hard to follow Lisa. I think what a compelling story. At Fan-Free Clinic, we've been around for 40 years. And 40 years ago, that was a long time, we were the only free clinic in the state. And as recently as 1992, there were only 8 free clinics in all of Virginia. And now there are 55. Well, that's a good thing and a bad thing. It's a good thing because we're really the safety net below the safety net. And it's good that we're there, and we appreciate all the support we get to keep going. It's a bad thing because we're really treating the symptoms and we aren't the cure. So what I'd really like to say is